One subject area of a lot of the work that we do is very often based around the scapular movement of the scapula and also of the thoracic spine. The reasons, of course, is not that this is better than any other area of the body, it's just that in many cases it can be very demoved, not moved as much as other places. Now, what can often happen, especially in the initial instances, if you have not been practicing types of thoracic spine movements or shoulder movements, scapular movements, is that the muscles can respond with quite a lot of tone, and they can become very tangled, very knotted, and very uncomfortable. Also, specifically with the thoracic spine, it can also be the case that it can become inflamed in the initial instances. Some cases we are actually dealing with the decalcification of aspects of the spine which, if not moved, would eventually become completely calcified. Of course, this is something that we have to manage as we move onward. It doesn't mean that these movements are bad for you, of course. Any movement can potentially be bad for you if it's done in an excessive proportion. But it does just mean that it needs to be managed as we go along, and soft tissue work, self-myofascial release in this instance, is one of those tools that we use in order to develop and maintain the quality of those tissues, namely looking at the scapula and the muscles around the upper back. The tool that we're going to use for the job is the good old peanut. Now, you can actually buy these now already like this. I made this back about 5 or 6 years ago and it's lasted all this time. These balls, they have little spikes on them, but they're not deathly spikes or anything. It just has some duct tape wrapped around it and then through the middle to keep it strong. For me, this size is perfect, and this is very important that you find something that fits your scapula. And the reason I say this is because you can also get these types of peanuts that are very, very small, very specific, that kind of just trace either side of the spine. Of course, the spine sits neatly into this, this groove here. I find that these are somewhat too specific because I also want to affect the muscles of the scapula, and we use some slightly different movements such as opening movements in order to trace as much as we can, to work over as much as we can. And what you can find is these more narrow ones just don't quite reach out far enough. Likewise, you can get peanuts which are quite wide and large, but then the issue with them is that they perhaps stretch out too far for you and end up working over the scapular wing, the bone itself, rather than affecting the muscles, and they perhaps don't take as much attention to the more central muscles of the scapula as well, down through the rhomboids. So this for me is absolutely perfect. You'll have to find the one that fits you. Now, we'll be going down through the middle of the back here, starting just below the cervical spine, so just below your neck, and then working our way down mainly to around the bottom of the thoracic spine. We may even go slightly lower down into the lumbar spine if it's something that you require. It does get a bit sensitive in this place though. Now, one thing I will re-emphasize is that we are not simply just rolling up and down the back. Yes, this feels therapeutic. However, we want to specifically target any trigger points, anywhere where there's excessive amount of tone, essentially anywhere where there's pain when pressure is applied. Ultimately, healthy tissue should not hurt when pressure is applied. So the very simple position that we're going to use is just lying on the back, and we're going to start with the peanut. So it's here on my neck, and then I just roll it just down below the largest bone at the bottom of my cervical spine. So where that large bone is, I just place it right in there. Now, first of all, we're going to cross the arms. And when we cross the arms, I'm just holding shoulder, holding shoulder. If you're restricted, then you just hold less, but I'm opening up the scapula. It also helps stabilize my upper body as well as I perform the movements. So just working here, I'm opening up. Now I will just shift myself up slightly. I arch my back upwards and I push it down into the floor. I arch it up, I push it down to the floor. I arch it up, I push it down to the floor. And this action
is what we're working with. And if I find somewhere that is tight, I'll just spend a moment on there. I maybe shift a bit left, shift a bit right, and then I work my way down visually down to the next vertebrae. I shift myself just up, and then I work again. Up, down, just working through, just checking, shift again, up, down, shifting again, up, down, up, down, up, down. Now, with this movement, we can also work with the hands just lightly supporting the head. If you find that you're getting a lot of tension in the neck, you can also just lightly support the head. Don't pull on the head, but you can just hold here and perform the same movement. But you will just have to actively protract to open up the middle of the back to receive the peanut. Okay, so just from here, working up, down, up, down, up, down, up, down. Again, if you find anywhere that's particularly painful, just spend some time on there. What you might find in some places, which I often do in the middle of my thoracic spine, is some clicking. Like you can work through these areas until they release, and you will feel a release afterwards as well. These are some of the places that we're looking for. Up, down, shifting, up, down. Now, if you feel you need a bit more intensity, that it's not enough, you can quite simply start to bring more of your body weight onto the peanut. Now, just be very, very mindful, because you don't want to adjust a vertebrae the wrong way. So, from here, for example, what I can do, I just bring my load up by lifting the hips. I take the head and I work up, down, move down, shifting through here. And again, if I find somewhere, I may just hold for a moment, maybe a bit of shifting left, right, just incrementally, up, down. Where possible, I advise working with the cross-arm version. You can work with both as well. Make sure that if you work one side here, work your way up incrementally, work your way back down incrementally, or vice versa. Switch the arms and then go again. So for me here, starting from the bottom, I can feel that one point there. There it is, my clicky point. Move a bit higher. Great. And just working into the upper thoracic as well. Now, if your peanut is the perfect size, then you can take advantage of the next drill. It's a little difficult to show, so I'll have to explain. But what I'm doing here, I bring my head and relax it on the floor, and now I'm trying just to open my scapula, and to try to relax it and shift the wings on the outside, so I can even get underneath the scapula. And here, there are some strange things living sometimes, so be quite wary. So it's right underneath my left scap at the moment. And if you're not quite getting the idea, so before I was holding the scap open like this, and now I'm letting the scapula just relax backwards. So the wings of the scapula are now falling either side here, and I'm rolling almost underneath the scap. From a back view, you may be able to see the difference. So firstly, I was working here like this, and now I open up and I just sink the scapula either side, and the left one doesn't. And here, you can very often find some specific places that you just need to spend time on. Just hold for a moment. Again, it depends very much on the size of your peanut and that it fits your scapula. So the last thing that we'll look at is then going into the lumbar spine. You have to be a bit careful here. Again, know your body, know your structure. So I normally start from having gone through the thoracic spine. So I've worked through the thoracic spine, and now I bring myself slightly more relaxed as I incrementally shift and bring myself lower. Now, I will not be rocking on my lumbar spine here. What I will actually be doing, I'm just searching for what is possible to relax and what is not possible to relax. Just as I might do when breathing in a passive hang, here I just work again visually, like one vertebrae at a time. Breathe, try to relax there. That's okay, no problem. I shift one vertebrae down. I breathe, relax there. You can have the hands by the sides if you want them here. I'm just lifting them so you can see a bit better. Breathe. Try to relax as much as possible. And if it feels okay for you, you can then really work into the lumbar spine. So bringing it down or rolling it down into the lumbar spine, sitting on top here. Now it's really in the top of the lumbar spine there. And I have to be careful as I breathe into it to see what is possible to relax and what is not. I shift again incrementally down. What can be relaxed? And what I try to imagine is it possible to just relax my spine either side of this ball? Or are there places where there is tension being held because perhaps injury or just perhaps from the daily practice? Ultimately, we're trying to relieve tone, relieve tension in the muscles so it doesn't block our movement, doesn't create pain. But of course, any potent tool is also a potentially dangerous tool as well, and it must be managed subjectively. And you can continue this exploration as deep as you like, right into the bottom until you reach, on the top of the sacrum. I may even trace those muscles even into the sacrum, just on the back of the pelvis, if necessary as well, if I'm getting something from it, if it's giving me something. And likewise, I encourage you that if you went down, notice I'm using my hands here and stuff just to help negotiate the movement. If I went down, I'm also going to go on the way back up as well. And it's not just this rolling up and down, it's working incrementally to release what can be released and just checking if there's any specific points that need attention more than others. Working my way down. And then, where necessary, continuing with the thoracic spine. So this was peanut rolling, notably for the scapula, the thoracic spine, also working into the lumbar spine as well. As mentioned previously, this tool can be used as much as it's needed. So in some cases, if you are experiencing a lot of tension in the traps, in the scapular area, in the upper back, once, twice, even 3 times daily if necessary. Ultimately, as mentioned, in and of itself, it is not a mobility development tool. It is a tissue management tool. However, we do want to ultimately have tissue that is healthy and that is our movement essentially keeps the blood flow in there, keeps the tissue quality there. In initial instances or in certain times when we've been working with new movements, this may not always be the case, and we need to assist and facilitate the recovery of those muscles back into health. So something like a peanut is very, very useful to use for this, but ultimately we don't want to have to rely on it. And if you find yourself consistently having to use something like a self-myofascial release just to be able to move pain-free, then there are some much deeper issues that you would need to get attended to by a specialist.